joining us. We welcome you to Mind Matters, the community mental health education event for NAMI Central Texas. Our event today is generously sponsored by Ascension Seton, and we are so grateful for their support. I am Dr. Quivera Moten, the Deputy Director for NAMI Central Texas. We have an exciting presentation today from Rachel Garner, who serves as Group CEO of the Right Step Hill Country and Promises Austin. Rachel, welcome to Mind Matters, and thank you for being with us today.
Good morning. Thank you, Dr. Kovar. I appreciate that introduction. I am going to jump right in here and share my screen with you folks. But before I do that, I just want to say a little bit about myself. As Dr. Kovar mentioned, my name is Rachel Garner. I'm a licensed clinical social worker supervisor. I'm the group CEO for the Right Step Hill Country here located in Wimberley. We are a 63-bed detox and residential addiction treatment facility, and we also specialize in treating co-occurring disorders. So I will be talking with all of you today about a topic that is very passionate to me, something that we really value and believe in here at the Right Step Hill Country, a neurosequential approach to addiction treatment and treating trauma. Before I jump into the content of the presentation, I have a few housekeeping items just to clarify as we get going. All of you you've noticed you're all automatically muted without video, of course, because this is a webinar. But please go ahead and complete the poll that should be coming out here in just a minute to give us an idea of who you are. We'd like to get a sense of who is attending today, and that can help me guide a little bit of my presentation to make sure you're getting everything that you want and need from it today. If you have any questions during the presentation, please use the Q&A, as Dr. Quivara mentioned. And while this is a webinar, it is still an interactive presentation. I challenge you to stay connected, grounded, and engaged throughout. I know it is very easy to multitask when we're watching webinars. I am guilty of that myself. So I'd encourage you to stay connected and gain everything that you can from the presentation. I will go back and forth between camera view and PowerPoint. As I mentioned, I'm interactive and I use my hands a lot. And so that's going to be part of the presentation today. And there will be formal time for questions at the end, but feel free to enter any questions you may have in the Q&A throughout. And but I'll try to address as I go. But like I said, we'll have plenty of time at the end as well. So I'm going to jump right in here. Before I do that, I just want to share a little bit about myself. I am, like I mentioned, a licensed clinical social worker. I've been in Austin, in Texas for about 5 years. I have worked in other states as a social worker and really been in the addiction treatment and mental health treatment industry for about 12 years across a few different states and different platforms. This topic is something that is really important to me, and I really I'm hopeful that this is informative for folks who are here, whether you're living with a lived experience, you're a family member of a loved one with addiction, trauma, mental illness, or if you're a provider in the field. I'm hoping that there's some useful information for everyone attending today. Okay, I'm going to jump right in here. So we're going to be talking about a neurosequential approach to treating addiction and trauma. A lot of folks ask, what does neurosequential mean? It's not a typical term that we're used to. I speak about it today as an approach to treating substance use disorders that incorporates a few different models, particularly the toxic stress model, a neuroscience approach, of course, and some child development theories, attachment theory, and the disease model of addiction. So the idea is that at its core, a neurosequential approach seeks to work with the brain and where the brain presents based on the individual rather than against it. Because sometimes some of our well-intentions as providers in the field or even loved ones and family members, we are working against the brain of the person in front of us, and it can be counterintuitive to what the person actually needs. So this model really seeks to understand and explain the classic behavioral symptoms that accompany substance use disorders. Some of the ones that we're really familiar with are chronic relapse. A lot of folks have multiple relapses in and out of recovery and using with this disease of addiction. Impulsivity is a hallmark symptom. Process or replacement addiction, so replacing one drugs or alcohol with another addiction is a common symptom. Dishonesty is something that particularly loved ones and family members can relate to experiencing. Implosive or explosive behavior, dysfunctional relationships, as well as the multi-generational nature of addiction and also trauma. So I'm hoping today that through my presentation, we'll be covering these items and helping ultimately provide some explanation and understanding, because we know that in order for people to get the treatment they need and get well, we need to start with understanding and explanation. So I'm going to start with a concept called the brain in the palm of your hand. And this is actually developed from, it starts from Dr. Dan Siegel from Child Development Theories, and I've sort of adapted it to fit with some concepts of addiction treatment as well as trauma and stress response. So I'm going to go ahead and put my hand up and walk us through this concept of the brain in the palm of your hand. If you're joining, you're welcome to follow along. Sometimes it's helpful to learn by engaging as well. This is a really nice exercise to teach loved ones, teach patients, providers, clients about kind of a basic neuroscience approach when we're talking about toxic stress and trauma. So in this model, in the brain in the palm of your hand, we start with our hand up here. And we're going to use our hand as a model for the brain. We've got, if we pretend that the wrist down the arm, the forearm, is the brain stem. This is the foundational, it actually connects from the back of our head down our spine. This is where our major systems, such as our nervous system, our central nervous system, which is responsible for our sympathetic and our parasympathetic responses. So our sympathetic is when that's part of our nervous system kicks in when we're stressed, and our parasympathetic system kicks in when we're resting and relaxing. So our nervous system is here, also our digestive system, our respiratory system, our major kind of core functions of our body is what the brain stem is responsible for. Next, we put the thumb down in this model, and the thumb represents the midbrain. In the midbrain, we have some parts that are called the amygdala, the limbic system, and also the our fight or flight part of our brain, which is where the survival mode kicks in. These are all the core mid portion of the brain. The limbic system in here is something that's really interesting to think about. This is the part of our brain that is responsible for when we go into autopilot. It's the part of our brain where we, as an example, if you're driving home from a long day at work, sometimes you'll be in your head and thinking about your day. You're not even aware of stopping at a stoplight, making a turn, because it's something that you do every single day. And all of a sudden you're home and realize, how did I get home so quickly? That's your limbic system responsible for storing those short and long-term memories. As a good example of that, I want everyone, if you could, on the presentation right now, go ahead and cross your arms. When you cross your arms, take a second and look down and notice which arm is on top, right? Which one is on top, which one is on bottom. For me, it's my right arm, right? So that's kind of I do that automatically without thinking about it. So take a second, notice which arm is on top, go ahead and uncross your arms, shake it out a second. And now I want you to consciously think about crossing your arms, but putting the other arm on top instead. I don't know about y'all, but it takes me a second to note it, to have to really focus and think about it. So now I'm trying to put my left arm on top rather than my right. That is an example of our brain at work. When we automatically put whatever your right or your left arm on top, that's our limbic system. Overriding that process requires extra thinking and extra process. And that is this other part of our brain here, which is called the cortex. So if we go back to our brain in the palm of your hand model, we've got the cortex here, the cerebral cortex, and the fingertips are the prefrontal cortex. This part of the brain is responsible for higher level functioning. It is where we have impulse control, our morals, our values, our judgments, our beliefs. It helps us distinguish right from wrong. It is where it's cause and effect thinking as well. So it's the part of our brain that says, if I don't step on the brakes right now, I'm going to get in a car accident. Or if I don't say this, I might get into some trouble in relationships, as an example. So that's the prefrontal cortex kicking in. This part of the brain all is closely connected. The prefrontal cortex is what actually, when it's engaged and working properly, it overrides this part of the brain, our limbic system, or sometimes this is called our reptile brain. In the reptile brain is where our pleasure center lives. The pleasure center, also known as the nucleus accumbens, is where dopamine is released. And in this part of the brain, it is where, when we have a really good experience, hear a really funny joke, eat really delicious food, or have a really meaningful relationship with someone, the nucleus accumbens responds and releases dopamine and makes us feel good. So it's the feel good part of the brain. Now, these two parts of the brain work hand in hand, the prefrontal cortex and the pleasure center, the amygdala, the limbic system. So as an example, I really love a really good donut. When I have that delicious donut, my midbrain, my pleasure center, dopamine is firing and it feels good. My prefrontal cortex kicks in when I say, you know, I'm only going to have one donut today rather than eat the whole dozen. That is these two parts of my brain working in tandem. The dopamine is released, but my prefrontal cortex says, you know, I'm going to only have the one donut. So that's sort of a basic example of how these two parts of the brain work together. Now, I want to rewind a little bit, because when we're talking about addiction and stress and trauma, it's important to understand the way that the brain develops and how this all comes online. Because development and early childhood, and even in utero, when a mom is pregnant with the fetus, all of the responses, all of the development of the brain and how that child is cared for makes a big impact on the developing brain. So when we talk about this model of the brain here, the brain develops from the bottom up. So all the way from when a woman is pregnant and has a baby in her utero, this part of the brain is developing first. It starts from the brainstem, and then this part develops, the midbrain, and then eventually the cortex, and then finally the prefrontal cortex. This brain development continues throughout our lives, and actually the prefrontal cortex, the higher road, the higher thinking, doesn't finish developing until ages 25 or 30. So when we think about an 18-year-old who is officially an adult, this part of their brain is online, but not finished developing yet. Similarly, when we think about the midbrain and when the prefrontal cortex starts to come online, children start to develop this part of their brain, or start to really use it when they're 2 to 4 years old. That's when this part of the brain comes online. So an infant is really living in midbrain survival mode. This brain, this child growing up, needs lots of caregiver nurturing, and is really just in survival mode, eating, sleeping, safety, being taken care of. We all have that part of our brain. So then this part of the brain comes online in toddlers. And so I'm sure we can all think of a toddler at some point in our lives who, when I think of a toddler, we often think of one of their first words is no. Or if they don't get what they want, they throw a fit. A big part of what is happening there makes sense with the brain. And what I like to call it is that child is flipping their lid. So when a toddler is in the grocery store and wants the toy or wants the candy bar, and they're throwing a fit and they're yelling and kicking and screaming, their lid is flipped. They are operating off of their pleasure center and the part of the brain that says, I want it now, I need it now, give it to me now. The part of the brain, the prefrontal cortex, that says, mom or dad say, no, I can't have that. That part is not engaged. That is offline. And so this is when the brain is learning these processes. Now, what this toddler and what this child needs in a situation like this is a responsive caregiver to help them learn to bring their lid back down and self-soothe and regulate. Now, there's a phenomenon called mirror neurons. All of us do it just as humans in the world. And so this concept of mirror neurons is also called emotional contagion. And so if we think of two brains in a room, we've got, as using this as an example, a toddler who's flipping their lid and a parent or a young child, perhaps. If this toddler is flipping their lid, the only way that this child is going to learn to bring their lid back down is if the parent keeps their lid down. And so when this child is screaming, throwing a fit, having a difficult time, really their reptile brain or their monkey brain is taking over. If this parent keeps their lid down and help the child self-soothe, this lid slowly comes back down. And this is where we're able to have positive parenting, and where the child foundation of a stress response in a child is developed. And it all is in response to the caregiver managing them. Now, the opposite is also true. If a child's lid is flipped and the parent or caregiver is stressed, having a difficult day, having a hard time, and they flip their lid as well, we all have seen this before. We've all experienced that before, right? Where the child is screaming, the parent is losing it, raising their voice, losing their temper. And we know what happens here, right? Everyone is upset. Everyone is stressed out. And while this is a normal response, if a child consistently is exposed to this, they do not learn to self-soothe in the same way. So this is sort of the foundation of a stress response in children. It happens in adults though as well. And so we all have relationships where we, I'm sure, have gotten into an argument and said something we don't mean, say something hurtful on accident, when that's our lids flipping. And I've definitely done that, gone into an argument and said things. And then later I thought, wait, what did I say? I didn't mean that. That's not really how I feel. That's my stress response, my midbrain reacting rather than my prefrontal cortex. And the reason that we do this comes from caveman days. Back thousands of years ago, when we were all cavemans and our brains, we were in survival mode. And so this midbrain is the fight, flight, or freeze response. So when we experienced a stressor, when we had to fight for our food, fight for our survival every day, we lived here. And this part of the brain is what was alive and well and taking over. The hormones that course through our body when our lids are flipped help us be stronger. Adrenaline, cortisol, those are the things that help us get through really stressful and difficult situations and help us survive. Now, over time, as humans have evolved, this stress response hasn't changed. So unfortunately, while our brains have really developed, we still respond as far as the neurochemical process in our bodies to a threat the same way did. So if it is, we are scared for our safety, say we're driving down the road and about to get in a car accident, our lid flips and we go into survival mode. So whether it's physical safety, and then also, unfortunately, if we feel emotionally unsafe, we respond the same way. And there are brain scans that have showed that the same stress response happens whether I am actually physically in danger or I'm emotionally in danger, or I'm feeling hurt or unsafe. And the same stress response occurs. So this is a very typical process that happens for all of us. When we're talking about this, though, I want to talk about stress on a continuum, because stress, the message here when we're talking about the brain and the brain developing from the bottom up, stress is not always a bad thing. And so I'm going to dive into the stress model to further understand how it impacts the brain and this kind of brain development. So as I mentioned, stress is on a continuum. We all experience it. Down here on the left, we have what are called positive stressors. And then if we move down this continuum, we move into tolerable stressors. And then further down, toxic stressors, and then what we call chronic, and then all the way at the far end are traumatic stressors. And so they're all ultimately on the same scale, but there are some things that differentiate them. Positive stressors, I'm sure we can all pause and reflect on a second and think about what are some positive stressors we've experienced. Here's just a few examples, right? Having a flat tire, work, having a work deadline, an interview for a new job, school, starting school. I know a lot of kids just started school again. That can be a stressor. Marriage, partnerships, having a baby, these are all things that can add stress. But if depending on the context and the environment, it can be positive. And positive stressors are things that motivate us, help us meet deadlines, help us grow, and learning to walk through that discomfort of stress helps us grow as humans and grow as individuals. Now, if we move down the scale to the next section, we've got this concept of tolerable stressors. These are things that not so positive per se, but we can tolerate them, and it's part of life. So maybe an argument with a loved one, it's tolerable. It doesn't feel good, it's painful, but it's tolerable. A deadline, depending on the nature of the deadline, it could really wear on you, but you can manage it. A home repair, maybe you have some flooding or some damage in your home. Can be a tolerable stressor depending on the context. A health condition, so if you have a chronic health disease, that can be, depending on the circumstances, a tolerable stressor, but not really positive. Similarly, parenting and finances. Worrying about money is a very common concern. It's a common stressor. For some folks, it's tolerable. For some people, it's further down the scale, depending on the environment. So then we move into toxic stressors. And this is when we cross over to the other side, where it really impacts the brain and the stress response. So these are toxic arguments, name calling, hurtful, really mean and painful arguments. Poor health. So maybe that health condition has deteriorated a bit. That can be a toxic stressor. Loss, of course, losing a loved one, a pet, to someone in your world, something in your world that's important to you. A natural disaster, depending on the situation, can be toxic or all the way down. Family sometimes, and a lot of times, especially families with addiction and or mental illness, can sometimes be a source of toxic stress. And then poverty as well, depending on the environment. Now, as we move further down this scale, we're moving into now what we call chronic stressors. These are items that toxic, but it happens regularly. It's happening all of the time, and there's not really any way to avoid it in your life anymore. So again, family can be a chronic stressor. Arguments, chronic toxic arguments. If you're arguing with a loved one, a family member, a friend, every day, and it's toxic in nature, that can initiate a really negative stress response. Frequent loss. We all experience loss, but if someone is experiencing losses at a high rate, that can move down the scale. Again, marriage, depending on the situation, kids, family, work can move down this way if it's not a supportive environment, and home. And then lastly, all the way down, kind of the most extreme end of this stress, is the idea of traumatic stressors. And this is where we think of PTSD or post-traumatic stress disorders, instances of abuse, neglect, natural disasters, violence, and something I'm going to talk about here in a minute called the ACEs, the Adverse Childhood Experiences. And so that is a series of events happening before the age of 18 that have been shown to negatively impact child development. And that can be addiction in the home, divorce, violence, of course, abuse, neglect. If a loved one or a family member or parent in particular is incarcerated, these are all examples of what are called ACEs, or adverse childhood experiences. So when we're talking about the stress continuum and talking about the brain and how stress impacts the brain, it's important to know, to assess what kind of stress is happening. Now, as I mentioned earlier, back to this lid flipping situation, we all do this normally. So a positive stressor, if I had a flat tire, depending on the environment, if I have the resources to handle that, if I have support, if I have AAA to call, or a family member or someone to come and help me, or I am well equipped to manage that myself, I may not flip my lid as much. But if I move down the scale, and if I don't have those items, if I don't have resources to purchase a new tire, if I've never had to change a tire before, if I don't have family or loved ones or AAA to support me, I may flip my lid and go into a stress response mode for something that for me may be a positive, but the person next to me may be tolerable, and all the way down the scale. So that's true for all of these items. The biggest factor that influences whether or not a stressor is where it falls on the scale is if the environment is supportive. And so back to this brain response, when we look at kind of chronic and toxic stressors, if we're experiencing stressors all the time, what's happening is your brain lives here. And so when we're in this mode, it's survival brain, fight, flight, or freeze. The amygdala, the limbic system, the nucleus accumbens are taking over. And the prefrontal cortex, the part of the brain that has the ability to manage those stressors, to problem solve, to have the motivation to do those things, is offline. And what we know about the brain is whatever we do regularly or with frequency, we create pathways for it to happen more often. So these exposure to chronic and toxic stressors cause pathways in the brain to grow and become highways to the stress response. So if I'm someone who's living in this toxic and chronic or traumatic stressor situation, my lid is going to flip much sooner, much faster, and much quicker as a survival response to protect myself than someone who's living down in the positive or tolerable stressors. And so it's really a catch-22, because the more stress and the severity of the stress that we experience, the more it's going to happen, and the more we're going to flip our lid. And the more that we flip our lid, the less resources we have from this part of the brain to cope with it. And so it becomes this really vicious circle. And the other things that we've learned is this chronic stress response is actually linked to chronic inflammation in our bodies, right? I'm sure we've all experienced that. We know that if you are really dealing with a big work deadline or a lot of stress at home or with family, with friends, we feel it in our bodies, right? We get tension in our neck, maybe your teeth, your jaw, your gut. Your gut in particular really is a good indicator of our stress. So we know that stress lives in our bodies. But what we're finding is, based on the frequency, and the research is showing, the more you're exposed to stressors with regularity, there's a connection with chronic inflammation. And so there's a lot more research coming out now on chronic inflammation correlated to health problems, right? Diabetes, heart disease, many, lung disorders as well, breathing disorders. There's a connection with inflammation and health outcomes. And so stress and inflammation is all closely connected to our physical health as well. And I want to talk a little bit more about this idea of toxic stress, because sometimes it's hard to know when something is toxic versus chronic versus traumatic. But this concept of toxic stressors particularly is relevant back to this when we talked about the toddler and the lid flipping here. It's particularly relevant when we're talking about a developing brain. So again, if we remember this lid flipping, and this part of the brain doesn't develop until 25, all little children need a caregiver to help them manage this stress. And so the concept of toxic stress happens when children experience severe, prolonged adversity without adult support. So whether the adult is unable to keep their lid down in response to the toddler, or maybe they're absent for any number of reasons. And this concept of toxic stress discusses how significant adversity early in life can alter a child's capacity to learn and adapt to stressful situations, as well as how sensitive and responsive caregiving can buffer the effects of such stress. So like I mentioned, it all is how the stress impacts you and or your family is greatly impacted by the environment. So if you have a really difficult, stressful work or school experience, but you come home and family is supportive, maybe you're going about your day with your lid flipped, but you come home and your family members' lids are down and it's supportive, and you're not worrying about health and finances and poverty and all of these stressful situations, that is a buffer to ultimately protect the brain for a developing child, which is how we end up as adults with stress response challenges. So this is just looking a little bit more at kind of the idea, your brain and body on toxic stress. So we have here on the left is the idea of, again, that positive stressor, our body experiences it. We may have, if I'm doing a presentation like this today, maybe a brief increase in heart rate, some mild elevation in stress hormones coming from that brain stem, but it's manageable. It's a motivator. Whereas tolerable, serious temporary stress responses, but they're buffered by those supportive relationships. And so maybe if you're having tolerable but regular stressors, that's when we get like kinks in our neck and kind of some headaches, some things that tend to linger and show up in our body. And then again, toxic, we talked about, it's the prolonged activation of the stress response system in the absence of protective relationships. So our brain's ability to manage stress is greatly impacted by our relationships and who we're surrounded with. Now, this pyramid here comes from something called the ACEs study. I mentioned that a minute ago, the Adverse Childhood Experiences study. This was a study that was done in the 90s, actually in Southern California, by a group from Kaiser Health Insurance. And they started studying the impact of what happens to you before age 18, impacting your physical and mental health. What was really interesting was this study came about from an obesity clinic. And there was the principal investigator, his name was Dr. Vince Felitti. And he had this really fabulous clinic, outpatient clinic for folks who had obesity and had all these health problems. And he had this really excellent model of health and nutrition and exercise to help folks lose weight and get healthy. And what he found was people who went through his program had excellent success rates. But once they went, they did the program for about a year, and then once they went back to their world and then came back for post follow-up, he found that people were gaining the weight again. And he kept saying, well, what is the problem here? What is the problem here? My program works. Why are they not taking this back to their home in their life? And so this launched a massive study of, I believe, almost 70,000 participants of Americans in Southern California. And what they found was when they started asking about ACEs, or adverse childhood experiences, before age 18, they found an extreme correlation to what happened to you before you were 18 to your physical and emotional health and well-being. So this pyramid here is known as the ACEs sort of pyramid. It's demonstrating the mechanism by which adverse childhood experiences influence health and well-being throughout the lifespan. So as we know, pyramid is built upon each other, on each layer. We know that at the bottom, if general embodiment or historical trauma is the foundation, from there, folks develop social conditions. And then on top of that, we have adverse childhood experiences, which ultimately lead to what's called the disrupted neurodevelopment. So back to this lid flipping example, if this child growing up in a home is not supported in managing that stress and taught ways how to do that by being modeled from their parents or their environment, the neurodevelopment is impacted. This stress response is a critical one for survival, but we cannot live here. If a child grows up living in this environment, it disrupts the development. Now, from disrupted neurodevelopment, then we develop social, emotional, and cognitive impairment. Adoption of risk health behaviors after that, which is inclusive of addiction and alcoholism, which I'm going to move into next. So there's a really direct correlation to our family environment, our stressors, our brain development, and then adoption of health risky behaviors in order to self-medicate or manage some of these stressors. And then ultimately, when we go up this pyramid with untreated and unmanaged items here, it does lead to more an increased rate of disease, disability, social problems, and ultimately early death. What the study found was with people with a higher ACE score, based on a scale of 10 questions of what happened to you before age 18, there were higher negative health outcomes and ultimately lived a shorter life. Now, what I wanted to clarify here is this study was looking at people who did not have treatment interventions. So there is hope, but it is important to really look at how our stress and our environment ultimately lead to our physical health and well-being. Now that leads me to the next part of this conversation. Now that we've kind of laid a foundation of the brain development, the flipping the lid process, and the stress response and how that impacts our development as our developing brain, I'm going to move into kind of overlapping theories of addiction and substance use disorder treatment. So one of the most common theories used in substance use disorder treatment and goes hand in hand with the disease model is the idea of the brain hijack theory of addiction. So I have here, you can see this brain, which is, for those of you that like to see an image, perhaps more than my hand, this brain is a model of what we just talked about. So we have here, you can see in the midbrain, that's this in hand model, that's the thumb. That's the nucleus accumbens, which is the pleasure center, the hippocampus, and the amygdala. And that's the connection of long-term memories and autopilot, kind of connecting all those pieces together. So this brain hijack theory of addiction, some folks may have heard of it, some not. It comes from the idea of addiction, right? And while substance use disorder is a more accurate term, addiction, the word addiction is derived from a Latin term for enslaved by or bound to. And anyone who has struggled to overcome an addiction or has a family member or a loved one really probably deeply experienced that and understands that. It becomes the focus of the individual and the family's world. And families often feel enslaved to this addiction. So while we use the term substance use disorder, addiction often describes the experience a little bit more. Another component of this theory is that a reminder that addiction is a chronic disease that changes both brain structure and function. Just as cardiovascular disease damages the heart and diabetes impairs the pancreas, addiction hijacks the brain. Recovery from addiction involves willpower, of course, but it is not enough to just say no. And part of what I'm hoping you take away from today is some of that stigma. There is unfortunately still a whole lot of stigma against people who experience substance use disorder or who are experiencing addiction. And often because of family members, communities, frustration, lack of awareness and understanding, we say, why can't they just stop? Why can't they just get better and get well? But we know the brain science actually explains it. And so there's a lot of reasons why somebody can't just stop using. Which is what I'm going to talk about here next. So I'm going to use this brain model here to talk about, play out a little bit more how this happens. And so if we go back to this brain in the palm of your hand again, if we think about the midbrain here, deep in there underneath our thumb, we've got the nucleus accumbens, which is the pleasure center. That is where dopamine is released. And dopamine is known as the feel-good hormone. It is, I think I mentioned that earlier, anytime we do anything rewarding or anything that rewards our survival mechanisms, back to that caveman brain, when we eat, when we sleep, when we're rested, when we have good connection with other people, when we have sex, when we do all of these survival mechanisms, our body releases dopamine. Now in our brain, these little red, triangles, arrows that you see here are representative of receptor sites. So in our brain, we have millions and billions of receptor sites. So this is just an example of a small scenario kind of scale to get an idea of how dopamine and receptor sites work. So pretend that this is a blown up version of the nucleus accumbens and the pleasure center. So in our brain, we've got these arrows that represent receptor sites. When we engage in maybe hear a really good joke and just are laughing and have a good belly laugh, our body releases dopamine. And so the D here represents dopamine. It releases dopamine from that nucleus accumbens. And what happens is those receptor sites absorb that dopamine and we feel good. That's when we have that really good feeling. Or say you're a runner and you go on a really great run and you get that runner's high. That's dopamine, right? Your body, your nucleus accumbens is producing dopamine to make you feel good. All of the different, having a really good meal. Again, we have a delicious meal, we feel satisfied, dopamine is released. So that's a normal brain process that happens for all of us. Now, if we add in the idea of drugs or alcohol produce a abnormally high amount of dopamine in our bodies. And what they do is addictive drugs provide a shortcut to the brain's reward system by flooding this nucleus accumbens with dopamine. So say this is my normal brain, this is my normal receptor sites. I now have a few drinks, 3, 4, 5, 6 drinks. What happens is, as I slowly add on more drinks into my system, the nucleus accumbens is flooded with dopamine. So like I mentioned, these addictive drugs provide a shortcut to this pleasure center, and the brain just floods with dopamine. And that's where the high comes from, or the buzz, or the euphoria. And so what's happening here in this brain is, as you can see, we've got only hypothetically 6 receptor sites, but 10, 12, 20 different dopamine that is released. And so what's happening in the brain is we've got all this extra dopamine floating around with not enough receptor sites to ultimately for the dopamine to attach to process and digest it and sort of handle those receptors. So this is where the high comes in. Now, for the typical person who maybe engages in some drinking or casual recreational drug use, they get the high, they feel good, it wears off, and then they go back to their normal routine where they get their usual dopamine sort of in and out based on regular activities. However, for someone who consistently is flooding the brain with substances, drugs or alcohol, so engaging in this process over and over, the brain is now experiencing this high, this flood of dopamine regularly. And our brains are fascinating. You know, as I mentioned earlier with the stress response, the more we use certain parts of our brain, that part of the brain will grow and adapt. So the same thing happens here. If I am constantly flooding this brain with dopamine regularly, daily, it becomes a habit. My brain says, whoa, what's going on here? I need to figure out a new way to adapt to this environment. What my brain's going to do is, it's really fascinating, is I am going to grow extra receptor sites because I have now trained my brain that this amount of dopamine is the new normal. This is how we operate now. So I grow extra receptor sites in order to deal with the new amount of dopamine. So what does that mean? How does that impact the brain? Well, this is where the idea of tolerance comes in. Because now, if I'm using regularly, and I'm using the same amount, say I used to have 10 drinks to get high, now those 10 drinks fill my receptor sites to get me to baseline, to get me to feel right, to get right, as some folks say. And so I'm no longer getting a high, because the high comes from the flooding of flooding of dopamine. So this is where tolerance comes in, because now I used to only need 5 drinks, and now I need 10 to get above, and then I need 15, or I only needed a few pills, and now I need 5, 6 pills throughout the day, or whatever it is. And so this is where the vicious circle of tolerance kicks in, and this is where addiction starts to take over. So what happens here, if I am now using regularly just to get right, just to have a baseline functioning level, I need more and more and more and more, and that's not sustainable. And the other phenomenon that happens is, if I now say, you know what, I'm gonna not use today. I'm gonna not drink, drug, whatever it is. If I go back to my normal things that I used to do, that really good favorite movie, or going on a run, or spending time with a loved one, my body naturally can only produce a certain amount of dopamine. So back to the example on a small scale, hypothetically 6. And so now I'm left with all of these extra receptor sites, and that makes me feel really, really bad. And that is where cravings come in. And so there's brain science behind cravings. My body, there's no way it can produce enough dopamine to make me feel as good as the drugs and alcohol did, right? No natural occurring response in our bodies can produce that much dopamine. So now this is where the brain hijack theory comes in, because this brain is now fully addicted. And this brain needs drugs or alcohol in order to, one, not feel sick, two, to not feel depressed, anxious, to feel normal, and to feel any bit of pleasure, because our body can't keep up with it. So this is where the brain hijack theory comes in. So what happens here is survival mode is kicked in. This is all happening here in the midbrain. The prefrontal cortex now is offline. So whether you use the lid flipped analogy or the image here of the yellow X, the part of the brain that should say, you know what, I'm using, drinking, drugging every day, it's causing problems in my life, I'm going to quit. That kind of thinking comes from the prefrontal cortex. And there are brain scans that show when somebody is in active addiction or alcoholism, that part of the brain is literally dark on brain scans. It is not, it's almost as if it's temporarily dead. It's temporary, but it's offline. And so this part of the brain is completely taking over. And so we no longer have the ability to regulate. And so this is the brain hijack theory of addiction. The reptile brain has taken over. And so for family members, for a loved one, this is where we often feel so frustrated and hurt and confused about, why won't my loved one stop? Well, there's the brain science. It's not about them not loving us enough, not caring for us enough, not being motivated enough. It's purely the brain science. So that brings us to, what does this brain need? What do we do about this? The good news is that there is hope. Treatment and abstinence heal the brain. The research has shown that with time, these receptor sites, these extra ones that have grown, atrophy and die if we no longer are using them. So in the same way that our brain grew these extra receptor sites to accommodate the new normal, if we remove all of the substances from the body for a certain amount of time, these receptor sites, your brain will say, oh, okay, this is the new normal. And those receptor sites atrophy and die. And so then somebody can get back to a normal dopamine process. But this process is really difficult, and it leaves the brain in a really raw and exposed state, living here all the time without the self-medication, without the drugs or the alcohol to self-soothe. And so there is a predisposition for someone who is trying to quit drugs or alcohol to flip their lid, and is often a trigger for relapse. I like this here a lot because this is the lizard brain, right? And it is all the lizard brain's fault. It is not the person's fault. It's the lizard brain's fault. That being said, the healing brain is an important thing to talk about because there is hope. An important reminder, though, is that it takes a lot of time. Stopping using for a week or so may get somebody through detox, but it is not going to heal the brain. A lot of the research in brain science shows that it takes 18 to 24 months for substance use recovery. So for that brain hijack process, that prefrontal cortex to kick in, it can take that long to learn for this part of the brain to manage the cravings and the pleasure center. It requires abstinence. So when somebody crosses over into that fully hijacked brain, some people don't cross all the way over. They may have problems with use, but they don't cross all the way over. It requires abstinence. That is the only way those receptor sites are going to atrophy and die. The other thing to know about the healing brain is it's going to continue to flip regularly, both from the dopamine cravings and the trauma response. So bringing it back full circle, one of the things that we know is children who grow up in an environment with chronic stress are more predisposed to developing addiction and alcoholism because of this stress response. So if we think about, if I'm a young child growing up with my lid flipped all the time, and then I grow into adulthood, this is exhausting. It's exhausting to live in this stress response state. So often folks seek, it's also not sustainable. So people need to find external ways to self-soothe and relax and bring the lid back down. And for a lot of people, it is drugs and alcohol. It is a fast way to release dopamine and to relax and calm and self-medicating, as we say. So this trauma response and this dopamine craving response together is a tricky combo and causes this lid to flip pretty regularly in early recovery. Another thing that is often neglected or forgotten in the healing brain is proper sleep and nutrition. It's often neglected. We don't think about that. It's in order to heal our body and our brain, we have to have good nutrition and good sleep. We also know that the healing brain thrives in a contained, safe environment, which is why residential treatment facilities exist, because the brain left on its own will continue in this vicious circle because the part of the brain that says I should stop using is offline. So that's why facilities like residential treatment exist, where the structure and the environment is created to allow for that, even when their prefrontal cortex doesn't want to do that or is offline. There are medications that are often supportive in this process to help. Some people are on medications in early recovery or long-term to help with this brain processes. The other thing that we know about the healing brain is that it heals in relations with other brains. So recovery from trauma and substance use is not something that can be done alone. It needs another brain because of those mirror neurons and those emotional contagion. So a couple other components of the idea of a neurosequential model of treatment is this idea of we go along with the brain. We take a bottom-up approach to recovery, meaning we don't engage in interventions or talk therapy because that requires the prefrontal cortex. We want to target the healing stage of the brain. So less focus on talk therapy and more focus on interventions that calming the hyperactive brain or this flipped lid. I mentioned, simultaneously incorporating trauma principles of unconditional positive regard, affirmations, and focus on safety because we're wanting to heal that trauma brain, but also components of substance use disorder treatment as well, and models of addiction treatment. The idea of the HALT model of 12-step recovery is hungry, angry, lonely, tired is actually really excellent for a neurosequential model. If somebody is feeling triggered or craving, whether it's for a trauma stress response or craving to use, checking in with hungry, angry, lonely, tired is a great acronym to remember it, but also helps take care of the brain. A couple other things with the neurosequential, it requires people supportive of the stress response. So it requires those around the person going through it to ride the impulsivity wave together, understanding and expect and be prepared for impulsive behaviors to pop up. Intentionally using emotional contagion and mirror neurons. So if you're a loved one or a provider, you can't flip your lid in response to the person who's experiencing it. If we keep our lid down, the other brain will naturally join us in time. So family members, treatment providers are play just as critical of a role in this brain's recovery. Grounding versus mindfulness is something I'm going to talk about here before I wrap up because I know we're running out of time. Grounding is an idea of using active techniques to calm the brain. So as an example, right, some folks may be looking for what is a concrete way that we can, a tool that we can use here. Oftentimes mindfulness is taught as a way to manage stress. And that absolutely is a critical component of managing stress, but it is for the positive, tolerable stressors on the scale, not so much the other end of toxic, chronic, or traumatic. So mindfulness versus grounding. Mindfulness is to be used during times of calm as a self-reflective practice. It focuses inward on the self. It's awareness on the present moment, while calmly acknowledging and accepting one's feelings, thoughts, bodily sensations. And it's used to increase consciousness and awareness of what's going on within you right now. And that, again, is better for the positive and the left end of that stress continuum. Whereas grounding is incredibly effective for the flipped lid for people on the other side of that continuum. It's to be used during times of duress in order to establish safety and detach from emotional pain. It's very present-focused, engaging activity using distraction to focus outward on the external world rather than inward on everything that's going on for me. It particularly focuses on the 5 senses as a tool to become present in the room and to avoid focus on feelings, thoughts. And so it really is very much engaged in with your senses around you. It's also taught as distraction, centering, a safe place. looking outward, and healthy detachment. So while I'm not going to go into an example today of what grounding might be, those are some good examples of where to start and where to look for in grounding and centering and safe place activities as a way to calm the brain and bring the lid back down in a moment of stress rather than times of calm. So this image here is sort of wrapping up everything that I've talked about today. I think sometimes it's easier to remember a lot of these concepts and this complex brain science and idea of animals. And so we've got the reptile lizard brain here, the monkey brain, and then the prefrontal cortex, which is the fingertips. That's the dolphin brain. And that is the part of the brain that is the most advanced of all animals in the animal kingdom. And it's the part of the brain that, like I mentioned, comes on latest in our development. And that is ultimately what we want to work towards, is identifying where the person in front of us, what part of their brain is active and presenting in front of us right now, and respond accordingly. That is really the neurosequential approach to treatment. So I have some references here, but I won't spend a whole lot of time going over those. I will go ahead and stop my share right now, because I believe we're about at time.
Well, we have a few questions for you.
Yes.
The first question is, first, thank you, Rachel. Thank you so much. Is it possible to get continuing education CEUs from attending this presentation?
That's a good question. We did not set it up in such a way for that today. So I apologize. This is not a CEU presentation.
Okay, thank you. The next question is, could MAOIs alleviate some of the psychological cravings of substances?
Absolutely. So there's a number of different medications that help with those cravings. There's some agonist and antagonist medications. I am not a doctor, so I'm not going to get into a whole lot of detail, but basically there's different medications that either fill those receptor sites or block them in early recovery to help with cravings. And depending on the individual and what their circumstances are, a doctor will help them pick a med to fill the receptor sites or block it.
Thank you. I know it may not be the best course of addiction with an addict because of all the substance diet restrictions. Just curious to see if it would work.
I'm not sure. I'll respond how I interpret that question. Diet and nutrition is a really important part of early recovery. We know that nutritional meals and balanced meals help fuel the brain, and exercise as well, right? So the more we get good aerobic exercise, we have better blood flow, and that helps our brain heal faster. So good exercise, good nutrition in early recovery is enormous.
Okay. Wayne says, great presentation. And the question is 18 to 24 months. Do younger brains recover quicker than older brains?
You know, that it seems like that would be a logical response, but the science has not shown that, actually. So it's really based on the supportive environment that we discussed and taking care of the brain once somebody stops using.
Okay. Is MAT considered abstinence? Does MAT support the healing of the brain in that 18 to 24 month period? Not pro or anti-MAT, just curious about the science.
Sure, that's a really good question. And for some folks, it may be controversial. I don't think it is. It is absolutely a tool towards brain recovery. So some folks, based on their history, based on other co-occurring disorders, medication-assisted treatment help them sustain abstinence and long-term recovery. There is excellent research that shows it does help the brain heal when managed properly and appropriately.
Okay. Are CBT and DBT equally effective treatments for addicts?
Absolutely, they're both very effective. CBT is the most researched and proven with addiction because it's a lot of thought reframing and behavioral responses. Because we know that that brain response, that limbic system I talked about, that autopilot, changing our thoughts and behaviors related to certain stimuli is very, very effective. But DBT also incredibly effective.
Okay. Are certain people more genetically prone to addiction than others? A family member of mine did one of those tests, and one of the data points was related to how prone to addiction they are.
Yes, so there is some genetic coding that happens that can predispose us for addiction. There is more and more research coming out, though, that as far as the environment and what's called the epigenetics. So the epigenetics is a study of what is coded onto our genes when we were in utero, in our mom's bellies. And so if a mom experiences more stress or is using that, some of that can code genes onto the baby while she's pregnant. There's also more and more research coming out that our environment and this stress response changes our brain structure, making us more prone to addiction.
Next I have, can we get a copy of the PowerPoint and or recorded presentation? The recorded presentation will be available on our website, on our Mind Matters page, so it will be available. And I know addiction is also propagated by a disrupted microbiome and impacts neurological regeneration. Would probiotics aid in recovery?
Well, I am not a doctor. I'm a social worker, so I don't necessarily prescribe certain probiotics, but again, a well-rounded diet, nutrition, absolutely. Having, our gut is closely connected to our stress response. So taking care of your gut really helps.
Why are typical treatment center programs only 28 days when it takes 18 to 24 months for a person to have the best chance of recovery? Maybe this is not the case. My knowledge is very limited on the variety of addiction programs.
Good question. So, and I forgot to mention that the first 30 days of abstinence from drugs and alcohol is when a vast majority of those receptor sites die. A lot of them do linger on 18 to 24 months, but the most intense post-acute withdrawal symptoms happen in the first 30 days. And that's when there's the highest risk of relapse. So that's why treatment centers are designed that way. The 18 to 24 months is folks have the best outcomes when they engage in what's called a full continuum of care. So they do detox, residential, and then a partial hospitalization, which is 30 to 60 days, and then intensive outpatient, which is 60 to 90 days, and then outpatient, which is 90 days. So that the continuum of care is designed based on what we know about the brain healing slowly and over time. So going to 30 days of treatment and then going right back to what you were doing before, not going to be super helpful. Engaging in the whole continuum gives much better chances of the brain healing properly.
Thank you. How well has brain science informed or conflicted with 12-step recovery and the primacy of a higher power?
I think that they go hand in hand. I mentioned that the healing brain requires relationships and heals better in the context of other brains. So again, this mirror neurons things. So we know that people cannot get sober or heal from trauma alone. And so 12-step offers that. There's also, I mentioned the HALT, the hungry, angry, lonely, tired. A lot of the 12-step practices, mantras, sayings go hand in hand with the brain science. One day at a time makes a lot of sense, right? Because one day at a time, the brain heals a little bit every day.
And how do you approach a client and experience advanced pancreatitis and liver failure?
That's a little beyond my scope. That's a little bit more a medical question. I would recommend talking with a medical provider.
Okay.
Yeah.
How does one find treatment that works for them? For example, a medication makes them feel like a zombie or makes them slow or slurred speech.
Sure. Really knowing that about yourself is really critical, and sharing that with your provider. I think a lot of folks are scared to say this medication makes me feel away because maybe they're not relapsing. So that's good. But then there's other symptoms or side effects. So people feel like they have to deal with those negative side effects because they're sober. But talk to your provider, talk to your therapist, talk to your doctor, talk to your family about it. That's really the first step.
Do you think addiction is propagated more through the epigenetic response to continued stress than genetics?
That's the age-old nature versus nurture argument. I think there's different approaches depending on your philosophy. I'm someone who's kind of split down the middle. And I personally, as the clinician, and based on my experience, I lean a little more towards environment. But there are some people who grew up in a supportive, loving environment, and their genes were coded in such a way that they developed an addiction or alcoholism. So both absolutely are true.
Okay. What are some basic resources for nutrition and exercise?
So I don't have any off the top of my head. I definitely can share them, but following a general well-balanced diet and getting exercise, what I do know with exercise, particularly aerobic exercise, getting your heart rate up, is really good for brain health. So, leisurely walks are great, but, stepping up the pace or really getting your heart rate growing, getting short of breath really helps with blood flow and circulation and inflammation, which of course helps heal the brain.
Okay. Someone says, thank you. My ears and years of drinking have caused permanent frontal lobe damage.
Not necessarily permanent. It takes a long time to heal. Continuing to drink will negatively impact that healing. But it can cause some damage. The important part is to get help now.
Okay. What is a good first step when you have a family member in active addiction? I don't know even how to bring it up. I'd love some tools or recommendations.
Yeah, that's a really good question. And that's probably a whole nother presentation. Maybe we can do that sometime. But real quick, I always recommend Al-Anon is a good place to start. If you're not sure, check out an Al-Anon meeting. They're online, so accessible nowadays. And you'll hear lots of really good tips. But I will say that the first rule of thumb is that addiction thrives in isolation and secrecy. The 3 rules of addicted families are don't talk, don't trust, and don't feel. And those all maintain addiction. So in order to break that cycle, you want to learn to talk about it, learn to trust and feel your feelings. So those are kind of my quick response. Don't keep secrets anymore. Go check out an Al-Anon meeting.
Awesome. I have heard that once an alcoholic, always an alcoholic. Do you believe this to be true? What if someone has been sober for many years and then drinks again? Why do they immediately go back to quick addiction?
Yeah, so I'm going to kind of focus on the brain science side. If there's a lot of people who have problems with drinking and drugging, but don't fully go over into an addicted brain or the brain hijack theory. So if somebody has completely crossed over and their brain has been hijacked, yes, once that process has happened in your brain, those pathways have been formed. And so in the same way, if you walk the same path in a field every day, that path will get more paved and it's easier to see it versus if you only do it every now and then, it's harder to find that path. So yes, even if someone has been sober for 30 years, those brain pathways are still there. So the reward center, there's still a huge highway in that person's brain that activates the reward center faster than somebody who never had an addiction. So yes, there's healing. Yes, there's recovery. And many people live long, happy, sober lives in recovery. But once you return, those pathways are still there. The brain remembers.
Thank you. What about the cost of treatment? If someone does not have insurance or a job, how are they able to pay for treatment?
Yeah, that's probably a pretty long, complicated question.
Yes.
Check out the website. We can share some links. There are a few state-funded treatment centers in the area that work with funding. Also, 12-step is an excellent place to get started. Check out a 12-step meeting. A lot of people there are connected and can help you know where to get started to find access to treatment.
And NAMI also has some resources that can be a support to you. So you can feel free to reach out to us and we can guide you to available resources in your area. see, what is the best way? The questions are coming. What is the best way to convince someone they have an addiction? They typically say they do not have an addiction and are in control.
Yeah, that's another one. Time to give a whole solid answer that you're looking for. The only thing that you can control is yourself and your response. As much as we try to control our addicted loved ones, it just doesn't work. So that's a good mantra to remember. Related to that, check your brain, check your own lid flipping. Right? Being in a relationship with someone who's addicted can be stressful and cause us to flip our lid a lot. So the first thing you can do is check your lid and make sure you're coming from this place rather than this place. Because if your addicted loved one is here and you're here, no one's going to hear each other. So that's step one. And I'm going to push again, go to Al-Anon. That's a great place to start. It's free, it's accessible, it's available on how do you start having these conversations.
This is in COVID responses have encouraged isolation. Does wearing a mask inhibit the brain healing process you described?
I have not seen any research that wearing masks impact the brain healing at all. Isolation, yes, isolation can negatively impact our mental health and the brain healing process. So it's important to connect with others however you can, virtually, connecting outdoors in safe ways. But no, wearing the mask does not impact our brain's ability to heal.
And do you have any recommendations for addicts struggling financially?
Yeah, again, that probably goes back to my previous statement. I recommend checking out a 12-step or Celebrate Recovery or Refuge Recovery, Smart Recovery groups, a self-help that is free and accessible. A lot of people get clean and sober through those programs. It just all depends on your environment. And if you need a higher level of care based on kind of your brain and where you're at, most folks in those rooms and those various meetings can help connect you. And
Okay.
you mentioned there's resources online as well.
And then could you repeat the 3 addiction rules mindsets?
Yeah, so addiction thrives in families that don't talk, don't trust, and don't feel. So what we want to do in step 1, you're not sure where to start. We want to do the opposite of that. We want to talk about it. We want to learn to trust, and we want to feel our feelings.
Thank you. And one final question, but I think you've answered this a little bit. What's the best way to convince someone with a mental health crisis to seek medical treatment? They may claim you are trying to institutionalize them. And I think for this question, it's important to allow your loved one to see you as their partner, and you are a support, and you partner with them to navigate the resources that are available, whether you find those resources through NAMI or Integral Care, but you partner with them, and we're going to navigate helping to get you support. So make them a part of the process, and that typically is usually more well received than dictating.
Yeah.
Well, Rachel, we just want on behalf of NAMI Central Texas and our Mind Matters, thank you so much for sharing all of this valuable information for us. And again, to all of you watching, this will be available on our NAMI website, and that's NAMICentralTX.org. And go to our Mind Matters section, and you can watch this to obtain any information you may have missed, or please feel free to share with everyone. And again, Rachel, thank you so much.
Of course, thank you for having me. Appreciate it.